Okay, so we talked about the PAE procedure. Now it's important to talk about what to expect immediately after the procedure in the days and weeks to follow. After the procedure, you'll go to the recovery area for 2 hours, and we usually plan on sending you home at that point. And what I ask is that for the rest of the day after the procedure, a patient basically is on bed rest at home for the rest of the evening and the rest of the night. Doesn't have to be strict bed rest, kind of like a couch potato is fine. But we just want to make sure you don't have any bleeding at the access site, whether it's in the groin or the wrist. The following day, you can get up and move around and do kind of normal light duty stuff. But again, I ask patients for about 4 or 5 days to really take it easy. And I don't want you to engage in anything heavy duty like sexual activity, exercise, heavy lifting greater than a gallon jug of milk. Again, for about 4 or 5 days after. And thereafter, you can go back to doing your normal activities, sexual activity, exercise, whatever you want. However, what you may feel like doing is a lot different than what I allow you to do. What happens overall, the way the procedure works is you cut off blood flow to the prostate gland, and the tissue in the gland that's around the urethra shrinks down and shrivels up, like going from a grape to a raisin. And it basically becomes scar tissue. And as it shrinks down, that part that's pinching off the urethra in the center kind of opens up, kind of like deflating the blood pressure cup, and allows urine to flow through. However, that doesn't happen overnight. It takes some time for that change to occur. And the first stage of that change is pretty substantial inflammation because the tissue is dying. So what I tell people is the first week after procedure, you're going to be worse than you were before. Those symptoms that you had, they'll be worse. You'll get a lot more kind of frequency and urgency because the prostate will be inflamed. The bladder will also be inflamed. And so you might find yourself getting up to go to the bathroom every half hour. It can be even more frequent, and it can be through the night, and it can last for, several days, up to a week sometimes. And so that can be pretty tiring. And so I tell people just to kind of plan on laying low for a week and kind of play it by ear. Some people will have those symptoms just for a couple days. Sometimes they can have them for, almost 2 weeks. Usually it's about a week. And the good news is we can get you through those symptoms usually pretty easily with over-the-counter anti-inflammatory medications like ibuprofen. Sometimes we'll prescribe a steroid medication to help with the inflammation. We want to make sure you drink a lot of water and stay hydrated. But usually we can get you through that first week. Then I tell patients week 2, after the procedure, you're kind of back to the way you were. Your symptoms kind of settle down, and you're able to kind of go back to your normal activities. If you're working, go back to work. By week 3, that's when people usually start to notice things are getting a little bit better. And by week 4, the end of week 4, almost everyone at that point is feeling a lot better.